All right, so we are ready for our next family chat. My name is Carrie West. I am the coordinator in transition programs, and I work directly with our family programs out of our office. And so we're excited to do our second family chat of the year. And we have with us a special guest today to talk to you about just general health and safety, the Student Health Center on campus. And so I'm joined today by Dr. Katherine Wessner, who is the former director of the Health Center and now an assistant vice chancellor for student affairs. So I appreciate you taking time out of your day to join us and share this information with our families as they have lots of questions. So just some housekeeping stuff for our viewers. We have some planned questions to get us started, but we encourage you to put questions in the comments, and we have staff set aside to either answer those questions or send you the links to the information that you need to know, or they might send the question to us for Katherine to answer live, I mean. So we probably have some people joining about now. And so, Katherine, just to get us started, can you talk about just in general, the guidelines that are going to be in place in the different areas of campus? So what students are going to have to expect in the classroom, in the dining halls, the residence hall, all that good stuff.
Sure, great question, Carrie, and I'm so excited to be here. So thank you for inviting me. But campus will look very different when people come back. You know, every routine will be slightly different. We know, though, that everything that we've put into place has really been done with the idea of trying to make students as successful as possible. So in the classroom, we have really limited the number of seats in the classrooms and to make sure that there's plenty of space for social distancing. So we've taken the chairs out when possible, and in some spaces just mark them as please don't sit here. So class density will be decreased, and we've moved classes to different spaces so that they can have more people in them. No class will have more than 50 people in person. So we'll see that. Students will be required to wear face coverings everywhere on campus when you're with other people, indoors, indoor movement in the classroom, in meeting rooms, in when they're eating or you know, getting in line to eat in queue lines, those kind of things. So during class, we'll expect people to wearing a face covering. Faculty will either be wearing a face covering or they'll be wearing a face covering up until the moment they start instruction, and then they may put on a face shield so that students can see them better. And then they'll put on their face covering right when they are finished with that. So we'll also see, like in the academic buildings, there will be less chairs and places to sit in the hallways. Because again, we're trying to make sure that people have the opportunity to social distance, and we're trying to de-densify spaces. In the dining halls, Aramark has done an amazing job to get ready. They have decreased the number of seats. They've increased the queuing space along with the Campus Life staff in Campus Life buildings as well. We will see lots more to-go options. We will see an app so that students can place their order ahead of time and pick it up. Students will have some spaces in the dining hall to eat. Again, those will be limited, but we've worked really hard to identify some additional spaces on campus so that students could take their lunch, like their grab and go lunch, and go find a place to sit, whether that's outside. We've added a lot of outdoor seating, which is exciting, but we've also identified some larger spaces that will be set aside for eating and also for studying. We know that, thinking about the classrooms, we know that a student might find themselves where they have an in-person class, and then their next period they have an online class. And so we want to make sure that there are spaces throughout campus that students could go with their laptop to participate in that online class. So we've done a lot there. In the residence halls, again, same thing. In the lounges, we've taken out some of the furniture. Many of the programs will be virtual instead of in person. In a student's residence hall room, they do not need to wear their face covering when they're in there, but when they're in the hallway, when they're heading to the bathroom, again, we're going to ask people to wear their face covering. So that will be important.
Yeah, so I think getting used to wearing a face covering, especially if you're not used to that, I know you talk about just practice, and it kind of becomes old hat, but really getting used to wearing it anytime they're outside of their residence hall room on campus. And I think, you talked about the queuing of the lines. And so we've seen those stickers in the grocery stores, like showing where to distance to 6 feet, trying to really make it very clear in all of the buildings where there are entrances or exits, where the waiting lines are going to be. And so just, I think, encouraging your students to pay attention to those things and try to follow those guidelines.
Yeah, the staff have worked really hard to get signs up all around campus, and you can see the common best for the Nest logo. And so it's actually kind of neat to see those, and the outdoor signs go up next week. So that's good. Thinking about practicing wearing your face covering, I knew that I had totally gotten used to it when I realized that I was almost halfway home yesterday and had forgotten to take it off in the car. And I was like, oh, you can take it off. You're the only person in the car.
Yes. Yeah. So talking about face coverings, do students need to bring their own? Or how would they pick up those face masks or face coverings?
Sure. So we're going to give every student and faculty and staff too 2 teal face coverings so that they have sort of our starter set. For the students in residence, you'll get those through the residence hall through the orientation welcome event for our new students, and then we'll work with Residence Life to get them at when you move in. For those returning students, we're also working out a plan to have several sort of pickup locations across campus so that students not living in the residence halls could get them from us. So those details will be unveiled next week. We do encourage people to bring additional ones with them. So we know that most of us have been having to wear them for several months now. And so I'm sure people have started to gather whether they're their favorite color or their favorite affinity group, or just some plain white ones that you've got at a big bulk store, and that's fine too. But really to supplement those 2, it would be good to bring some others with folks. Also, that way you get to bring some that you know that you like. So for example, some prefer ones over the ear, some prefer ones that you tie, some like the gator kind. So really whatever it works for a student. And if anyone has trouble with that, let us know, and we have some resources that we can help people with.
Mm-hmm. Yeah, no, I know mine, I prefer one that has a nose guard, so it kind of helps with the fog of the glasses. So the ones that we were given, the teal ones, they do fit my face really well. And so I think that for the majority of students, I think that they will fit really, really nicely. I think it's also important for face coverings because in the state of North Carolina, especially if they're coming from out of state, in the state of North Carolina, they are required in any place that you go into now that you cannot, and even outside if you cannot practice social distancing, correct? We're still in phase 2 of the governor's plan.
Yeah.
So I think, so switching a little bit, if a student has concerns or they're in a higher risk group, they have concerns about wearing face coverings or anything like that, who should they talk to?
Sure. So depending if a student has is at high risk due to a chronic health condition, they should reach out to the Disability Resource Center. If they have a concern about wearing a face covering or really any other concerns about COVID, they should reach out to the health center through our email address, which is coronavirus@uncw.edu, so that we can work individually with students on whatever that issue is and find the best solution for them.
Thank you.
Yeah.
So I want to encourage folks to be putting questions in the comments section on Facebook. If you have questions, have follow-up questions, something we've been discussing, we have staff that are answering some of those questions. Or if we want to, we can ask Katrin to answer something live. So I just want to encourage you to do that. So Katrin, can you talk about in general, what overall health and hygiene practices should students do to stay healthy while they're living and learning here on campus?
Sure. So if you're from North Carolina, hopefully you have heard about our 3 W's campaign that the governor's office and our Department of Health and Human Services has put out, which is wear, wait, and wash. And other states have similar campaigns. So it may not be 3 W's, but it may be something. Those are really those are the primary ones. There's a few others, but those are primary. So obviously wear your face covering at all times. Wait, which is really strictly adhering to that social distancing requirement. It actually isn't a bad idea to measure what 6 feet is, so you get a better sense of what that space is. And then wash, which is wash your hands often. And this is something that I've been saying my whole career. So it's interesting to see that it's gotten a little bit of more traction now, but wash your hands often. Soap and water is obviously our preference. We have tons of bathrooms with lots of soap and water. So that's the best option. And when you're in that restroom, wash your hands, get a paper towel, use that paper towel to turn off the faucet, and then use that paper towel to open the door, and it will be even safer. But then also for when soap and water isn't easily accessible, hand sanitizer that's at least 60% alcohol is a great option. So we've placed over 700 hand sanitizer stations around campus, pretty much at almost every entrance and exit door, elevator, staircases, that kind of thing, so that students will have ready access to hand sanitizer during the course of the day, so that if you don't have soap and water easily accessible. It's really important to wash your hands before and after you eat, before and after you do an activity. I would encourage them, like if you're sitting down at a computer station, wash your hands before you type on the keyboard, wash your hands after. Anytime you go to the bathroom, if you sneeze, cough, anything like that. So it's really important to do that all throughout the day. And then there's other things like, you know, don't touch your face. And that's hard because as soon as I say that, you know, I want to touch my face. But the more that we can keep our hands away from our face, the healthier we'll be. That idea of washing down surfaces regularly. So I think of, you know, my cell phone. How many times do I wipe that off? Making sure once a day we do that. Our keyboards on our laptops or our desktops, those high touch surfaces that we are in control of. And I know we're going to do some extra cleaning on campus of doorknobs and stair rails and elevator buttons and those kind of things. But what do I have control over that are my commonly used surfaces that I need to wipe off? Sometimes even your keys or your ID. And then that idea of not going to class or to work if you are sick, right? So that idea of we're going to ask everybody to do a daily health assessment where we're going to ask you to answer a series of questions. Do you have a temperature or feel like you have a history of a fever? Are you experiencing coughing or shortness of breath, difficulty breathing? And then a variety of other symptoms, including things like chills and muscle or body ache, fatigue, loss of taste or smell, which is definitely a COVID-like symptom. And we're going to ask people to answer those questions every day. Every student, faculty, and staff will get a daily email starting the first day of class that will remind you and have a survey that you're going to say, yes, I don't have any, or I do, and it's going to tell you what to do. So really making a commitment that if you're not feeling well, that you don't go to class and that you communicate with your professor. And that if you do have symptoms that you contact, if you're on campus or in Wilmington, that you contact the Student Health Center. Students that are you know, doing remote learning and are in a different part of the country or state certainly can call us and we'll help give advice at the health center, but you can also go to your local provider, obviously. But if you're on campus or in the Wilmington area, the Student Health Center is doing testing. We're ready to help. That staff is great. And we want you to do that instead of going out when you're sick. So some of those are some of our higher level things that we want to make sure that people are doing. And then obviously, you know, getting enough rest and eating a balanced diet, making sure you get enough non-alcoholic fluids each day. Those are, of course, always good preventative practices.
Yes. So we got a question, kind of a follow-up to when you were talking about cleaning, you know, those high-touch surfaces that we're using every day. Are there any specific cleaning products or things that you recommend the students bring to be able to clean their own kind of personal items?
Sure. So if you want to bring something with you, you know, if you could get something like a Clorox wipe or a Lysol wipe, I know that some parts of the country can find those. Some are struggling a little bit. You could also bring a spray cleaning product that you then use, you know, a paper towel or a rag or something like that. One of the things we have talked to the computer staff about is that they prefer a wipe kind of thing on like keyboards and mice. They don't want it to be too wet. So if you if you had a spray bottle and you sprayed it onto a paper towel or a rag or something, you want to just make sure it's not like dripping because we don't want to hurt our computer equipment. The other thing is that many of the things that we own, you'll find on their websites will talk about how to clean surfaces. So I know some people are like, oh, I have a really specific piece of equipment, or, you know, I have a fancier monitor than most, or I have a different kind of watch. Just making sure what those requirements or recommendations are. But yeah, some basic like a Lysol or a Clorox or a spray, whatever spray cleaner you might use in your kitchen. The nice part about coronaviruses are that the traditional cleaning products already attack that kind of a germ. So normal everyday kind of things will work. Yeah.
It's just in maybe watching down those things more often than we think that we need to. Right. Like watching your phone down every day. It's not something you might have done in the past, but it's something you need to do now.
Right.
Yeah. We got a question from our question earlier about if students are in a high risk group or something, or they who cannot wear a face covering when they're entering buildings, like is someone going to stop them, or is there going to be some kind of proof that they have that they've gone through the Disability Resource Center or the health center?
So when we have had a student or faculty or staff who've contacted us about trouble wearing a face covering, what we'll first do is talk to them about why and what part of the face covering is an issue for them. And many times what we found, actually, and almost everyone I've talked to personally, we've been able to find a solution, whether it's a different shape or size, a different style, like maybe that's a surgical mask or a disposable mask, that kind of thing. Depending on their health risks, sometimes people have chosen to go online, but we'll work individually with folks to make sure that we have the right solution for them. And then we'll make sure they have whatever they need to show people.
I appreciate that.
Yeah.
So another question that we got is, will students, faculty, and staff be required to sign any waivers when they come back to campus?
So we do not plan to do that here at UNCW. I know other schools have, but that is not something that we've planned to do. We do, though, want to stress that this is a community responsibility, right? We are all in this together, and we have put health and safety as our primary guideline, and really the way for that to be successful is that everyone plays a part, that everyone commits to wearing a face covering, everyone commits to being socially distant, to being that 6 feet apart, commits to washing their hands. So rather than have someone sign a waiver, we're really trying to focus on, we are a Seahawk community and we look out for each other, and that's really how we're going to approach it.
Mm-hmm. So I think you mentioned earlier about hand sanitizers being placed across campus. So the question is, we know students are being provided masks. Will there be hand sanitizer and hand washing stations available to students? Can you just repeat that again for them?
Sure. So there are obviously soap and water would be our preference, that there are plenty of bathrooms with soap and water everywhere. But when there isn't easy access to a sink, that we have put 700 hand sanitizer stations around campus. And I will tell you, they seem to be everywhere. We'll have them readily filled if they run out. And that way that is very accessible to students, whether that's entering or exiting a building and near a stairwell or near an elevator, they're in the residence halls. So there's lots of hand sanitizer on campus.
Awesome, thank you.
Yeah.
We've gotten some questions, it looks like, in the comments about just where to go find this information, or if there's going to be a data dashboard somewhere online. Can you talk about the Best for the Nest website a little bit?
Yeah, sure. So we do have a website that's called Best for the Nest, and it has all of the information we've talked about. And it also has a really robust set of FAQs, so that frequently asked questions, so that we can get you the latest information. One of the things I think we found is that when I always use the metric of, if I've been asked a question 2 or 3 times, it needs to be on the FAQ list. So I'll write out my answer and I'll send it to the university relations folks who keep up the website. But that has not only recommendations for students, faculty, and staff visiting, it's got some health and safety guidelines. It does have our data dashboard. It has a link to some COVID-19 information, and also a link to how to get more information. So for example, it has the link that says the email address coronavirus@uncw.edu. So it's a good one-stop shop if you need information. And then if there's a question on there that you can't find the answer to, that's when you would email coronavirus, and we can one, get you the answer, and then we'll look at adding that to the FAQs.
Yeah, and that email is coronavirus@uncw.edu. So there's a couple of questions in the comments asking about, if a student does test positive, what are the policies and procedures going to be to quarantine those students?
Yeah, great question. So we do have an identified space, and actually a couple spaces if needed, for quarantine and isolation. And so if a student tested positive, if they were in contact with someone who'd been diagnosed with COVID, or if they were awaiting a test result, then we would move them, if they're an on-campus student, to the quarantine isolation space. We are hoping, depending on capacity, that if an off-campus student did not have the ability to quarantine or isolate in their apartment or where they're living off campus, that we would be able to offer that to them as well. But that quarantine isolation space will be staffed 24 hours a day. We have arranged for food delivery. There are linens available if people need them. We have arranged for IT support so that people can still participate in their classes. We will have a member of the health center staff check on them daily. Medical care will be available if needed, and then they will stay there for the time that they are in quarantine, and then we will help them transition back to their residence hall or off-campus apartment. The question we get sometimes, Carrie, is whether people could go home, right? And if you, I think that'll be up to a family really to have that conversation. We'll have the health center staff will have a little bit of part of that too. But if a student can easily drive home, is driving by themselves, if they're feeling fine, are not, their symptoms, if they have any, are not such that they can't drive, and they have a place at home that they can successfully quarantine, then we would support them doing that. But if the student had to fly, if someone had to come get them, if they told us, you know what, my parent or a sibling or my grandmother or grandfather lives with me and they have an underlying health condition, then we would talk to them about that. Probably an on-campus quarantine is the best option. But we do recognize that some students will want to go home, and that will be fine. We'll still keep up with them. We'll still call them every day, make sure things are going okay.
Yeah, thank you for that.
Mm-hmm.
So another question is, will students be able to access the health center in person, or will they be evaluated over the phone?
Oh, good question. So the health center has been open the whole time. So even though students and faculty and staff, many of them left to do virtual education and virtual work, the health center stayed open. We have both options available, telehealth and in person. Some things you do need to be seen in person. It is really hard to remove earwax over the phone. So yeah, so there's both options, and students can call ahead to get a consult. The one difference that the Student Health Center has this year is that that we really need people to call ahead before coming over so that we can begin to have that conversation with them and talk about what the best option is. But both options are
good. Awesome. So another question was, what items should students bring for those like health assessments I believe you talked about earlier? Like, do they need to bring their own thermometers, or what kind of general things do you recommend students bring, like aspirin or things like that?
Sure. So I think anytime, regardless of COVID or not, that a student is heading off to campus, a basic first aid kit is a great idea. So some Band-Aids, antibiotic kind of ointment, a good pain reliever, a cough medicine, cough drops, those kind of things. I wouldn't bring any prescription medication that a student doesn't already have a prescription for. Sometimes we have people like, oh, I still have an antibiotic in my closet, I'll send it along. Nope, if it wasn't prescribed to the student, please don't send it. But it would be good to get a thermometer if you can. Again, some areas you can get them easier than others, but that wouldn't be a bad idea.
Awesome, thank you. We got a question about counseling services, and I know that they're not in your direct unit, but can you talk a little bit, or speak a little bit about that, how they're going to be doing services this fall?
Yeah, so counseling will mainly do their routine appointments via telehealth or telepsychology, teletherapy, but they will have, their office will be open for more urgent walk-ins to be able to be assessed quickly, but their routine care will be all virtual. They will also do a good number of virtual programs and sort of prevention programs and education programs, which the health center will as well through health promotion and Crossroads.
Yes, thank you. No, the health center, the counseling center, and also our care office are all up on the second floor of DePaula Hall. So they are, I think a good rule of thumb would be to call and just check in with them and then see if you can schedule a telehealth appointment. Mm-hmm. Okay, so I'm not receiving any other questions at this time. So I think we've answered a lot of them. And I know our staff are working through the comments, and we will continue to check those comments and answer those questions in there as well if we haven't gotten to yours yet. But Catherine, I want to say thank you for taking time out of your day to do this. We really do appreciate you just kind of talking through some of these questions that I know a lot of families are having right now as they get ready to pack up and to send their student here to campus. And so we do appreciate you. And so thank you to our families who joined us for our family chat today. This session was recorded and it will be on our Facebook page once we hit the end live button, and then we will upload it to our YouTube account later so that you can watch it or send it to people who weren't able to watch it today. And we hope that you'll be continuing to check our website for our next family chat as we release those, as we try to do these every month with a different topic. and just to help, another way to help families stay involved and engaged with campus and keep you up to date on everything that's going on. So if you have any questions, don't hesitate to email our office is transitions@uncw.edu. And if you have coronavirus questions, the email is coronavirus@uncw.edu as well. So we are going to get off here today. And thank you so much, Katherine, again.
Oh my gosh, thank you. We are so excited for school to start, and anything we can do to help, we're happy to do so. So thanks for all you do to help our students get settled on campus.
Thanks. Y'all have a good day.
All right, bye.